Welcome to another video of the Marylebone Implant Centre. Today I'm going to talk to you about bone. Patients, they ask me frequently what happens if they don't have enough bone in order to have their implants placed. Well, thankfully nowadays we have different surgical procedures that will allow us to create that bone. That kind of procedures that we usually call bone grafts. We can do it either in conjunction with the implant placement or previous to the implant placement. So let's say that I have a situation or I have a patient where I would like to place an implant and I have no bone enough in order to anchor my implant. Then in that case I will have to do my bone graft beforehand, and then once that bone graft is mature, then I can place my implant. But I have also other situations where I have enough bone in order to anchor my implant, but I don't have enough bone to completely cover my implant. So in those situations, sometimes what we prefer to do is to actually do the bone graft in conjunction with the implant placement. Most of the times for the bone graft, we don't use bone taken from the patient. That's those techniques, they used to be done many years ago. They used to be called the gold standard of bone grafting techniques. Not anymore. That statement is now outdated. There are other products available in the market. Here in the Marylebone Implant Centre, I like to work mainly with a company called Geistlich. This is a German company that's been around for almost 30 years now, and they have a product. There is a bovine material-based bone, so basically it's cow bone without any organic particles, just the middle part of the bone, very similar to a synthetic material that then we will utilize in order to create that bone graft. So in reality what we will be doing is creating a scaffold that will be utilized by the bone cells from the patient in order to create the bone that is missing. So the patient's own cells, they will read the bone graft and then they will use it to create the bone where the bone is missing. So we know that in the future most of that bone graft, if not all the bone graft, will be completely replaced by the bone from the patient, and that bone will be good bone that will be able to support our implant. So as I explained before, I mean, either we can do it beforehand or we can do it at the same time as we place the implant. So we don't have to go back to another part of the body of the patient and do a second surgery that most of the times is uncomfortable. So we can just utilize a material off the shelf, as we usually say, that will be very good and will give us the same results. So it is possible to recreate bone. There are many different techniques depending on the quantity and the type of bone that we have missing. We may use a different type of bone graft procedure, but generally speaking, the good news is that yes, we can create that bone and we don't have to take it from the patient's body. I hope that this video helped you to understand a little bit more about bone grafts, and I will see you soon to talk more specifically about each of these surgical procedures. Thank you very much for your attention, and I will see you soon. Bye bye.